All right, let's talk about something that's super common, but also super uncomfortable. The urinary tract infection, or UTI. We're gonna get straight to the point and give you a clear, simple guide to understanding what's going on. You know that feeling? It can start just like this sudden, out of nowhere, desperate need to find a bathroom, like right now. It's such a classic sign, and it can totally throw your whole day off track. And this quote, wow, it just perfectly nails that frustrating cycle. You finally get to a restroom, but then almost nothing comes out. And what does? Well, it burns. And then, not even 30 minutes later, that urgent feeling is back. It's just relentless. So let's break it down. What exactly does a UTI feel like? I mean, what are those telltale signs that tell you, yep, this is probably what I'm dealing with? Knowing the symptoms is absolutely the first step. Okay, so here are the big five. First, that constant urgent need to go that we talked about. Then there's that unmistakable burning or stinging feeling when you do. You might also look and notice your urine seems kind of cloudy. A dull, nagging pain in your lower back or belly is common too. And sometimes you might even see a bit of blood, which, can be pretty scary. Now listen up, because this is super important. If you have those symptoms and you're running a fever, getting chills, or have a really sharp pain in your back, that could mean the infection has spread to your kidneys. That is serious stuff. Don't wait. See a doctor right away. Okay, so we've got a handle on what it feels like. But why? What is actually happening inside our bodies to cause all this trouble? Let's get into the nitty-gritty of how these infections get started. So at its core, a UTI is basically an invasion. See, normally the urine in your bladder is sterile. It's totally clean, no bacteria. The infection happens when bacteria from the outside, usually just from the skin, find a way to travel up the urethra. And once they're in the bladder, they start to multiply like crazy. And get this, it turns out there's one main bad guy responsible for most of this. A whopping 80 to 90% of UTIs are caused by E. coli. And the really wild part? This is the same bacteria that lives totally harmlessly in our guts all the time. It just has to get into the wrong place. So you might be wondering, why do some people seem to get UTIs constantly while others almost never do? Well, it turns out there are a few key things that can make you more vulnerable. And honestly, the biggest reason just comes down to basic anatomy, kind of like plumbing. For women, the urethra is only about 3 centimeters long. That is a very short trip for bacteria to make it to the bladder. Now compare that to men, where it's around 25 centimeters long. That's a much, much tougher journey for any bacteria trying to sneak in. And that simple difference in anatomy has a massive, massive effect. It means women are an incredible 8 times more likely than men to get a UTI. It's just a fact of biology, but one with some pretty major consequences. But it's not all about anatomy. Other things play a huge part too. Things like hormonal shifts during menopause or pregnancy can raise your risk. And even simple habits, right? Like not drinking enough water or holding it in for way too long, that just gives bacteria more time to grow. Poor hygiene and even some types of birth control can also be factors. All right, enough about the problem. Let's talk about the solutions. If you think you've got a UTI, what's the game plan? How do you get on the path to feeling better? So first things first, and this is non-negotiable, you've got to see a doctor. They'll probably have you do a quick and easy urine test just to be sure it's a bacterial infection, and then they'll give you what you really need, antibiotics to wipe out those invading bacteria. And please, please listen to this part. It is so important. You might start feeling way better after just a day or two of the antibiotics, but you have to, absolutely have to, finish the entire prescription. If you stop early, you risk leaving the toughest bacteria behind, and they can come back even stronger. So while that medicine is doing its job, there are a few things you can do at home to feel a little more comfortable. For one, drink a ton of water. It literally helps flush the bacteria out of your system. A hot water bottle on your lower belly can really help with that cramping feeling. And maybe try to steer clear of things like coffee or super spicy food, which can just irritate your bladder even more. Okay, now for what might be the most valuable part of this whole thing. How do you stop UTIs from even starting? Let's talk about staying ahead of the game. I know, we've all heard this a million times, but it is so true here. A few simple, proactive habits can save you from a whole world of pain and misery later on. This is it, seriously. This is probably the single most effective thing you can do. Always, always wipe from front to back. It's such a simple motion, but it physically keeps bacteria away from where it can cause an infection. It makes a huge difference. And here are a few more really great tips. When you have to go, just go. Don't hold it. Also, make it a habit to pee right after sex. It helps to flush everything out. And think about your clothes. Breathable cotton underwear is your friend. Super tight clothing isn't, because it can trap moisture and create a perfect environment for bacteria. And hey, here's a final tip that actually has some science behind it. A study found that drinking about 300 milliliters of cranberry juice a day, that's a little more than a cup, can actually help stop bacteria from sticking to the walls of your urinary tract. Pretty cool, right? So there you have it, the what, the why, and the how-to for dealing with UTIs. The most important thing is to know the signs, get help when you need it, and build those simple preventative habits into your life. The only question left is, are you ready to take control of your urinary health?